Welcome to the video on discriminatory dissolution method development steps. So till now I have made many videos on discriminatory dissolution, and in those videos you will find much details and the idea about this topic. The reason for making this video was to make you aware about the steps. This video will give you complete understanding about the development steps for discriminatory dissolution. First of all, we should know about what is discriminatory dissolution method, what is discriminatory power. So, the dissolution method and the parameters and the specifications which gives you understanding about the different formulations which may not be good or which may not be the bioequivalent. Discriminative dissolution testing is important and crucial in determining how different formulations or manufacturing variables affect the release profile of the drug. And the main objective of discriminatory dissolution method is that we can differentiate between the good formulations and the bad formulations, or the good batches and the bad batches. QC release media or QC release dissolution method is required to be discriminatory so that the batches which may not be bioequivalent can be restricted for going to the market. So the discriminative dissolution can differentiate between slight variations in formulation, manufacturing processes, and stability conditions, and that's why ensuring that the formulations performs consistently under real life conditions. The steps for development of the discriminatory dissolution method are first starting from the understanding of the drug properties. Test different dissolution medias, compare dissolution profiles, optimize the media, and then go for the method validation. This video is also important for the professionals who want to understand the development of QC release media or QC dissolution method, because many times the professionals get confused between discriminatory dissolution and QC release media. So don't get confused between those. QC release dissolution method is required to be discriminatory in nature. So you should learn from this video regarding both the dissolutions. Steps for discriminative dissolution method media proof, we should go for step by step. Understanding the drug properties. So understand the drug behavior, its solubility, its BCS class. Understanding the drug properties include the development to begin the process of selection of discriminative dissolution media. You first need to fully understand the API characteristics like API solubility, how the API is soluble in different medias. Permeability affects how the drug is absorbed when it gets dissolved. pH dependency. Some drugs release better in specific pH conditions. That is also called as pH profiling or pH dependent solubility. Then know the BCS class, for which the drug belong to class 1 or 2 or 3 or 4. So we should know and understand the drugs BCS class. Then coming to the test different dissolution medias. So after knowing the BCS solubility and dissolution of API or dissolution pH of the API, we should go for the different medias. Common medias are like the medias with pH relevant to the GI environment. pH 1.2, pH 4.5, pH 6.8. These pH are selected considering the GI pH range. pH 1.2 simulates acidic stomach environment. pH 4.5 represents gastric to intestinal transition. pH 6.8 simulates small intestinal environment. Surfactants can be used if the APIs are insoluble and if the sink conditions are not meeting. Surfactants like sodium lauryl sulfate enhance the dissolution of poorly soluble drugs like BCS class 2 and 4. Then know the agitation speed, increase or decrease flow to simulate different GI conditions. Generally, the standard dissolution conditions are selected like basket apparatus, paddle apparatus with the media volume of 500 ml to 900 ml or 1000 ml. Then understand the key considerations for poorly soluble drugs like BCS class 2 and 4. Surfactants can help to improve the solubility and ensure that the dissolution test is discriminative for formulations where solubility is a limiting factor. For immediate release drugs, buffers in the pH range of pH 1.2 to 6.8 are generally sufficient to capture the dissolution profile across the GI tract. Sometimes pH 7.5 buffers can also be used. Also, in testing different dissolution medias, you can study the effect of composition of the dissolution media on the drug release. Then compare the dissolution profiles. After testing dissolution of the formulation in different medias, the next step is to compare dissolution profiles across various formulations or under different storage conditions like temperature and humidity. Formulation variations can be studied like the effect of API PSD, effect of different excipients like binders, fillers, disintegrants, and the API form also you can study how it affects the dissolution. Then manufacturing process variants, investigate how changes in compression force or granulation method or granulation time, powder flow, tablet hardness, binder capabilities, binder levels, disintegrant levels can affect the dissolution profile. The example here, compression force I have considered for tablet formulation. A higher compression force may result in a slower dissolution due to higher tablet hardness. Granulation method. Wet granulation versus dry granulation can affect the dissolution rate due to the differences in particle size and porosity. Powder flow. Poor flow can lead to inconsistent tablet weight and the dissolution behavior. But many times powder flow is not considered because the powder flow is a secondary parameter and it is not directly related. But still I have considered here. Powder flow can be improved and tablet weights are required to be controlled, but for sure the granulation time, compression force and the storage conditions can be considered as a variants for dissolution profile comparison. For insoluble drugs, mainly the particle size is considered. Optimize the media is the fourth step. Method is to be required to be optimized. So first is optimize the media. Based on the results of dissolution profiling, you can optimize the media. This process involves adjusting pH, including surfactants, alteration of the agitation speed, change in the dissolution media volume. So these are some of the points to consider for optimizing the media. Adjusting the pH, tailoring the pH to better match the drug solubility characteristics, including surfactants if needed. For poorly soluble drugs like BCS class 2 and 4, surfactants can be used. Alteration of the agitation speed, simulate different GI transition conditions and get more discriminative profile. For example, for BCS class 2 drug, the use of sodium lauryl sulfate SLS in the media may allow you to better distinguish between the different formulation and manufacturing processes. Also consider the specification time points for having the discriminatory power. Fifth point is method validation. Once we optimize the dissolution media, the next step is to validate the method. This involves ensuring reproducibility, verifying the ability of the media to discriminate between formulations, that is batch to batch variability, and change in the stability conditions or effect of the different storage conditions, stability conditions onto the dissolution behavior. Confirming that the dissolution test is sensitive to differences in the drug release, excipient composition, particle size, and manufacturing processes. So these are the different steps involved in development of the discriminatory dissolution media. You can also refer these steps for development of the QC release media. Discriminative media considerations based on the drug types. So poorly soluble drugs may be there, and these may be formulated in immediate release or sustained release. Then some soluble drugs may be there. So based on the solubility of the APIs and formulations, the discriminative media should be considered. Poorly soluble drugs, surfactants like SLS can be used, and then the SLS concentration is required to be optimized for getting the discriminatory dissolution media. The surfactants like twin 80, polysorbates, then triton, CTAB, these are also used. Immediately release drugs, that is immediate release formulations like tablets, capsules. For these, the buffer medias can be used, which may have the pH 1.2 to 6.8 in this range. The formulations containing BCS class 1 and 3 drugs, these are soluble formulations. So for these drugs, surfactants are not used because these drugs are highly soluble. So sink conditions are easily achieved considering the solubility. But for poorly soluble drugs, surfactants are required to meet the sink condition. Coming to the key variables to investigate for discriminative dissolution media. So you need to provide the proof that the method is discriminatory and method is having discriminatory power. So some variants should be selected, and these are the key variables. Formulation variations like excipients, particle size distribution is there. Excipient level can affect the dissolution. So different excipient like binders, filler, disintegrants can be used. Different PSD APIs can be used. Manufacturing process variants like critical process parameters, compression force, granulation method, binder capacities, and then stability changes. Impact of the temperature and humidity, impact of the storage time, that is required to be evaluated, and based on that you can justify the discriminatory power. So for example, exposure to high temperature or humidity can lead to hydrolysis, affecting the solubility and the dissolution. The polymorphic form change may also be there. The aging may have impact onto dissolution rates because of change in the physical characteristics of the formulation and the APIs. Sometimes polymorphic changes may happen. So these all are the key variables. So in summary, the discriminatory dissolution media development involves steps like understanding the drug properties, testing different medias, comparison of the dissolution profiles, then media optimization and validation of the method. Understanding drug properties for evaluating the solubility, permeability, and pH dependencies. Test different medias like media with the pH range of 1.2, 4.5, or 6.8, with or without surfactant, and with different agitation speeds and the media volumes. Compare dissolution profiles, analyze how formulations, manufacturing processes, and stability conditions affect the drug release. Also, one point I want to mention here is that we need to select the apparatus also. So based on the formulation, suitable apparatus is required to be selected, like basket apparatus, paddle apparatus, or USB-3 apparatus or USB-4 apparatus. Then optimize the media, adjust the media to ensure sensitivity or formulation and the process changes onto the dissolution results. Validate the method. Ensure the dissolution method discriminate between the formulations and meet the regulatory requirements. So this was the information for discriminatory dissolution method. Now, one thing I wanted to add here is that the specifications are required to be relevant to the guidelines, and these should be set based onto the bioequivalence batch or bioavailability batch or clinical study batch. So generally the specifications are set considering the dissolution profile of the reference formulation and also the test formulation has uh, which was studied or had been studied in bioequivalence study. So depending on the formulation design, API properties like solubility and BCS class, the dissolution specifications are required to be set. I have made many videos on those points, so you can go through those videos to have idea about the dissolution specification and the acceptance criteria. But here in this video I am mentioning because sometimes because of the specifications the dissolution media may prove to be discriminatory or may prove to be under discriminatory or over discriminatory. So selecting the specific acceptance criteria is very critical when you are going to prove the discriminatory dissolution method. So I hope you might have got idea about this topic, and if you have any queries, please comment. Go through the videos on dissolution method development, discriminatory medias. Many videos are there on this channel. These are available in the playlist, and those videos will help you to understand this topic. Thank you for watching the video.